Hello, I'm Dr. John Monaco of AllStride. I've talked to you before about issues related to childhood obesity, and I'm coming to you today from my office in the hospital where I take care of hospitalized children. I have to say I'm talking to you today because I'm upset, a little frustrated, and really hoping that you will help me with this problem. And here's what I mean. It's gotten to the point that almost the majority of the kids that I see in the hospital have issues related to their obesity. If not something caused by being overweight, it's something made so much worse by being overweight. And I don't think the general public realizes this. I don't think the general public realizes what a profound problem this is for children in terms of making them sicker. This is not a cosmetic issue. Sure, we have to deal with self-esteem issues, and that's vitally important. But also, we're dealing with kids who literally their lives are threatened because of this. And not just in the future, I'm talking about right now. I've talked to you about these asthmatics who come in and really wouldn't even be here if they weren't overweight. They might not even have asthma if they weren't overweight. We've talked about type 2 diabetes that we're seeing more and more. But there happen to be 2 cases in the hospital right now that just sort of have me very upset because I know that if it wasn't for their obesity issues, they wouldn't be here. One is a little 10-year-old girl with pancreatitis. Now, mind you, her pancreatitis might have gotten her in the hospital no matter what her size was. But because of her being so overweight, it's very difficult to get IVs in her, to give her medicines, to give her fluids, even to draw blood. These are very important for sick kids in the hospital. She's had to go to the operating room and get a special line placed, which opens her up to complications and the use of general anesthesia and a lot of things that wouldn't be necessary if her weight problems hadn't made it so difficult just to give her basic medical care. So that frustrates me. That upsets me. That's a preventable situation that we don't need to see. The other is a young lady with a kidney stone. Is her kidney stone related to her weight? Well, maybe not directly, but you know what? It's certainly directly related to the foods she eats. Her general care of herself, her general health. Her understanding of hydration and what to drink. Not sodas, but maybe water. These are the kinds of things we're dealing with. So it upsets me. I still think, although there's so much press about childhood obesity right now, that we still need to raise the consciousness of people. And that's why I'm talking to you today. This issue is resulting in kids being sick right now. We talk about the future and how their life expectancy may be affected down the road. But it's making them sick right now. We have to start doing something right now. I know I seem a little bit passionate about this, and it's because I am. I'm really kind of frankly getting tired of it. I love these kids. I love taking care of them, but I don't want them to have to be in the hospital. So help me. Go to allstride.com just because you can have a voice there, and we can hear from you, and we can begin to push this movement, which really needs to start from us, all of us at the bottom, and work up. Don't count on the government. Don't count on the schools. Don't count on the food advertising. It's got to start with us and our families. So help me. Help me keep these kids out of the hospital. And I will greatly appreciate it, and I greatly appreciate you listening to me today. Thank you. We'll talk again soon.